So we're going to go over just a brief overview of the muscular system, specifically the axial musculature in this video. So the skeletal systems of the body, right, they're going to be divided, or subdivided rather, into the axial musculature, right? Skeletal muscle will be divided into axial musculature and appendicular musculature. Sometimes when I'm saying appendicular and axial, I might say skeletal afterwards, but we're going to be discussing those skeletal muscles, right? So the axial musculature, these are going to be muscles that position the head in the vertebral column, and they're also going to be able to move the rib cage, right? For the appendicular musculature, those are going to be muscles that stabilize and move the appendicular skeleton, right? And we'll be able to look at that. So the muscles are going to be innervated, right? All of these muscles, they're going to be innervated by nerves. Okay. The axial muscles, they can be placed into 4 groups based on location or function. Okay. Number 1, they could be based on the muscles of the head and neck, muscles of the vertebral column, muscles of the rib cage and lateral walls of the abdomen and pelvic cavities. And then we have muscles of the pelvic floor, okay? So several groups of muscles of the head and neck are muscles of the facial expression, those extraocular muscles, muscles of mastication, muscles of your tongue, muscles of the pharynx, and then those anterior muscles of the neck. So when we're looking at muscles of the facial expression, right, they're going to be divided into 5 groups, okay? Mouth, eyes, scalp, nose, and neck, and they're all going to be innervated by the cranial nerve 7. Okay, so let's look at the image actually, right? So this orbicularis oris, right? This muscle right here, that I just underlined, right? That's going to encircle the mouth, right? And so that's going to be able to constrict the opening of the mouth. Okay, then we have this buccinator right here, right? This buccinator, it has 2 functions that's going to be related to feeding. It's going to be able to move food back across the teeth from the space inside the cheeks. And also in infants, it's going to be responsible for producing the suction required for suckling at the breast. Okay. We have this temporal pariedalis, right? It's going to be cut and reflected right here, this muscle right there. That's going to be located under this epicranial aponeurosis right there. And we also have the occipitofrontalis. It has a occipitofrontalis. So it has a frontal belly, right? That's going to be like on the frontal portion, right, under that frontal bone, right? It also has an occipital belly. That's going to be like on the occipital bone in the back, right, posterior of the head. But it's going to be separated by this collagenous epicranial aponeurosis. Okay. And then you have the plazisma, and that's going to cover the anterior surface. So it's going to be right here, right? Right. So that's going to cover the anterior surface of the neck. Okay, so the front of the neck, and extend from the base of the neck to the periosteum of the mandible and the fascia at the corners of the mouth. Okay, as you can see at the corners of the mouth right there. Okay, so those are going to be those muscles of the facial expression. Okay. Now, when we look at those extraocular muscles, or they're called oculomotor, right? These are, sorry. If we want to look at it, right? We have extrinsic eye muscles. That's going to be these are going to be muscles that control eye movement, right? We have intrinsic eye muscles. Those are going to be smooth muscles, and they're going to be inside the eyeball, and they're going to be able to control the pupil diameter and lens shape. Okay, so they're going to be inside the eyeball. Now, these extraocular muscles, right, they're going to originate from the surface of the orbit, right? They're going to insert onto the sclera of the eye. Okay, so they're going to insert onto the sclera of the eye, just posterior to the cornea, and they're going to control the position of each eye. Okay, so you have the medial and lateral rectus muscles. Okay, so you have the medial and lateral rectus muscles, and remember rectus means straight, right? So rectus means straight, right? So we have these straight eye muscles, right? And of course, the medial rectus is going to rotate the eye medially. The lateral rectus is going to rotate the eye laterally. Okay? You have the superior rectus and you have the inferior rectus, right? The superior rectus will rotate the eye upward. The inferior rectus will rotate the eye downward. Okay? We also have the superior oblique right here, and we have an inferior oblique, right? That superior oblique is going to rotate the eye downward and laterally, right? Downward and laterally. Whereas the inferior oblique is going to rotate the eye upward and laterally, okay? So you can see. Okay. Now when we're looking at muscles of mastication, okay, these are going to be the muscles that move the mandible at the temporomandibular joint. Okay, so we have the masseter, this large one right here, this large muscle right here, the masseter. That's going to be able to elevate the mandible. Okay, this is going to be your most powerful mastication muscle. And mastication means chewing, right? This is going to be your most powerful chewing muscle. We have the temporalis, right? The temporalis muscle. This one right here, under that temporal bone, or on that temporal bone, right? So this is going to be able to assist in the elevation of the mandible too. Okay. We have the pterygoids. Okay, we have the lateral and medial ones. Okay. And so they're going to be used in various combinations. They can elevate the mandible, they can protract it, they can slide it from side to side, and that side to side movement will be lateral excursion. But all of these are going to be innervated by cranial nerve 5. Okay. We have muscles of the tongue, right? We have intrinsic tongue muscles. They're going to originate and insert all within the tongue. And then we have extrinsic tongue muscles, and they're going to originate from structures outside the tongue and insert onto the tongue. Okay? And they're going to have the name ended in glossus, meaning tongue. Okay? So when we're looking at these, we have the genioglossus, right? The genioglossus is going to be this muscle right here. That's going to originate at the chin, but it's going to insert onto the tongue. Okay? We have the hyoglossus, right? Hyo here. These muscles, again, they're going to originate at the hyoid bone, and they're going to attach onto the tongue. We have the styloglossus right here, coming from that styloid process, and so it's going to originate at the styloid process, and it's going to attach to the tongue. And then we have the palatoglossus, okay, right? The palatoglossus, right? That's going to originate at the palate and attach onto the tongue. Okay. And so the genioglossus, hyoglossus, and styloglossus, right? These are going to be innervated by cranial nerve 12, whereas the palatoglossus, that's going to be innervated by cranial nerve 10. Okay. So we have muscles of the pharynx, right? Muscles of the pharynx are going to be these paired pharyngeal muscles, and they're going to be important in the initiation of swallowing, right? So when we're looking at these, we have those pharyngeal constrictors, right? These pharyngeal constrictors, right? The superior, the middle, and the inferior constrictors. So they're going to begin the process of moving a bolus, right? That chewed food mass, into the esophagus. We have these laryngeal elevators, okay? They're going to elevate the larynx, okay? They're going to be able to elevate the larynx. We also have these palatal muscles, okay? These palatal muscles up here. They're going to be able to raise the soft palate and adjacent portions of the pharyngeal wall, and so they're going to be able to also pull open the entrance to your auditory tube. Okay, pull open the entrance to the auditory tube The auditory tube is also called the eustachian tube, okay? So these constrictors, they're going to be innervated by cranial nerve 10. The elevators, right, these laryngeal elevators, they're going to be innervated by cranial nerve 9. I'm sorry. Well, 9 and cranial nerve 10. And then you have these palatal, right? These muscles are going to be innervated by cranial nerves 5 and 10. Okay? So we also have anterior muscles of the neck, right? So we have a couple of them, right? And so they're going to be able to control the position of the larynx. They're going to be able to depress the mandible, tense the floor of the mouth, provide a stable foundation for muscles of the tongue and the pharynx. And we have extrinsic muscles. They're going to be able to position the larynx, whereas those intrinsic muscles are going to affect the vocal cords, okay? And so we have these anterior muscles of the neck, okay? So let's look at them, right? You have these digastric muscles, right, with an anterior and a posterior belly, okay? They're going to open the mouth by depressing the mandible. Okay, you have this mylohyoid right here, this one right here, and that's going to provide muscular support to the floor of the tongue. You have this geniohyoid, okay, that's going to provide additional support. You have the stylohyoid, that's going to form a muscular connection between the hyoid bone and the styloid process of the skull. Okay, you have these sternocleidomastoid muscles. Okay, they're going to extend from the clavicle and the sternum to the mastoid process of the skull. Okay, so are they sternocleidomastoid? Okay, you have these omohyoid muscles. They're going to attach to the scapula, the clavicle, the first rib, and the hyoid bone. Okay. And we also have the sternothyroid, sternohyoid, and then the thyrohyoid. Okay. We have muscles of the back, right? So they're going to be divided up into 3 distinct layers. Superficial layers, there's going to be those extrinsic back muscles, and they're going to be able to move the neck. You have intermediate layer. They're also going to be extrinsic back muscles. They're going to be able to move the vertebral column. We have this deep layer, right? Those are intrinsic back muscles, and they interconnect the vertebrae. Okay. So we have the superficial layer, right? The superficial layer, we're going to have the splenus capitis, the splenus cervicis. These 2 muscle groups are going to perform extension or lateral flexion of the neck, and they're both going to be innervated by those cervical nerves. Okay. So when we describe the word capita, right? Capita means that muscle will insert on the skull. Cervices, that muscle is going to insert on the upper cervical vertebrae. And thoraces, that's going to be able to, this muscle will insert on the lower portion of the cervical and upper portion of that thoracic vertebrae. Okay. When we're looking at these, the intermediate layer of these intrinsic back muscles, they're called erector spinae muscles, and they're going to be grouped into 3 different type of muscles, right? The spinalis, it's going to be the most medial one, the longissimus, and the iliocostalis. So if I can show you a picture of them, right, that would be best, so you can see it, right? So we have these erector spinae muscles. Okay. And so if we look, we have this spinalis. It's going to be more medial, more in the middle. Okay. We have this longissimus. Okay. It's going to be the long ones, right? That's the cervices ones. But then we have the longest capitis one. It's going to insert on the skull. Okay. We have the longissimus thoracis. Okay. Insert onto the upper portion of the thoracic. And we also have the iliocostalis muscles, right? They're going to be the most lateral of these three. As you can see, right, there's iliocostalis lumborum, iliocostalis thoracis, iliocostalis cervicis, right? They're going to be most lateral. And so these divisions are based on the proximity to the vertebral column, right? With the spinalis group being, the closest and the iliocostalis being the furthest away. Okay. So looking at the muscles of the vertebral column, right, we have spinal flexors. Okay. So they're going to be a few are going to be associated with the anterior surface of the vertebral column. We have the longus capitis, the longus coli, right? These longus coli, they're going to be the above. Wow. Okay. Let's go back. There we go. So the above two muscles, right? These longus muscles, they're going to be able to rotate or flex the neck. Okay. And then we have this quadratus lumborum, and I guess we can see it better on this image right here, this quadratic lumborum right here. And that's going to be able to flex the vertebral column laterally. Okay. Be able to flex the vertebral column laterally. Okay. So moving to the abdomen region, or the abdominal region, we have muscles of the oblique and rectus, right? So oblique and rectus muscles. And so the muscles of the oblique and rectus groups, they're going to lie between the vertebral column and the ventral midline. Okay. So oblique muscles, they're going to compress underlying structures or rotate the vertebral column, whereas rectus muscles, they're going to be important flexors of the vertebral column, acting in opposition of that erector spinae muscles, okay, from the back. And so these muscles can be grouped into like cervical muscles, thoracic muscles, and abdominal muscles, okay? When we look at the cervical muscles, right, you're going to have these scalene, right, muscles, these scalene muscles. So let's be able to look here, okay? You're going to have these scalene muscles, right, up here. Okay, and you're going to have an anterior, middle, and posterior one. So all of these scalene muscles, they're going to elevate the ribs, right? Elevate the ribs for inhalation, right? You also have these thoracic muscles, okay? Those are going to be those intercostal muscles, okay? They're going to be those intercostal muscles. So we're going to have like a external intercostal muscle and internal intercostal muscle. So these intercostal muscles, they are oblique muscles that lie between the ribs. So the external intercostals, they're going to elevate the ribs, right? So these will elevate ribs, whereas the internal intercostals, they're going to depress the ribs, okay? You also have these transversus thoracic muscles. They're going to also depress the ribs, okay? And we have the serratus posterior muscles, okay? The serrator posterior muscles. So you can see the anterior one, right? The superior serrator muscles, they're going to elevate the ribs, whereas the inferior ones, they're going to be able to depress the ribs, okay? So we have a whole lot of just movement of the ribs here, especially for breathing, right? When we're looking at the abdominal muscles, actually, because we can just look at this, right? We have the external oblique, okay? You can see right here the external oblique, okay? That's going to compress the abdomen or depress the ribs laterally, and it's going to flex the torso. The internal obliques, though, that's going to be able to compress the abdomen, depress the ribs laterally, and also flex the torso, right? Same function as the external oblique. We have this transversus abdominis, okay, or rectus abdominis. And And that's going to be able to compress the abdomen. Okay. Looking at these rectus muscles, right, you again have cervical region, thoracic region, and abdominal regions, right? We have what we'll see the diaphragm, and that's going to be able to contract and expand the thoracic cavity. Okay, that's going to be in that thoracic region. Okay, those rectus muscles, that's going to be in the cervical region. They're going to be the genohyoid, the omohyoid, the sternohyoid, the sternothyroid, and the thyrohyoid muscles. When we're looking at the abdominal region, we have the rectus abdominis. Okay, so this is the rectus abdominis. That's going to start or begin here at the xiphoid process, and it's going to end down here near the pubic symphysis. It's going to be able to depress ribs and flex the vertebral column. It's also going to consist of this linea alba that you can see right here. Okay, that's going to be a median collagenous partition that's going to divide this muscle longitudinally. Right, that's where you see those white lines. Okay, and you have this tendinous inscription. Right, these tendinous inscriptions. Right, these white bands. Basically, right, there are going to be bands of fibrous tissue that divide this muscle into 4 separate repeated segments. Okay. Then we have the diaphragm, right? So let's look at the diaphragm. So the diaphragm is going to be this major breathing muscle. Okay, it's going to be this major breathing muscle. So when it contracts, the diaphragm will lower it will lower to increase the volume of the thoracic cavity for inspiration. Where it will relax, right? The diaphragm will rise. The rises to lower the volume of the thoracic cavity, okay, for expiration. But again, it's going to be that major breathing muscle. And we'll finally look at, that's part of the axial musculature, muscles of the perineal region and the pelvic diaphragm. So here's an image right here. So this perineal region, or this pelvic floor, right, is going to be divided into 2 triangles. Okay, we have the urogenital triangle, right, for male and females at birth. And then we also have the anal triangle. Okay, so the urogenital triangle, right, these two, you're going to have, this is going to be that anterior portion, right, or that anterior triangle. You're going to have superficial muscles. They're going to be the muscles of the external genitalia. They overlie deep muscles that strengthen the pelvic floor and encircle the urethra. And you're going to have those deep muscles that will constitute the urogenital diaphragm. Right? That's a muscular layer that extends between those pubic bones. When we look at the anal triangle, that's going to be that posterior triangle, right? It's going to include that pelvic diaphragm, and that pelvic diaphragm is going to form the muscular foundation of that anal triangle. Okay, it's pelvic diaphragm. Okay, and these 2 triangles, notice how they're going to be separated by the superficial transverse perineal muscle, right? So it's inside. Can't see it right there, but you can kind of see it right here. Right? These triangles are going to be separated by that superficial transverse perineal. Okay, so that was just a brief overview of the axial skeleton. Okay, thank you.